Hi, my name is Dr. Mad, and today I'm going to do your cranial nerve exam, if that's okay. I'm gonna need your first name and last name and also your date of birth to be able to log you in. Okay, let's go ahead and do that. So, go ahead. Can I please have your first name? And your last name. Okay. Your date of birth. Okay, 88. Perfect. Do you have any allergies? Okay. That's good to know that you don't have any allergies. And is your address still the same? Good. Can I please have your phone number? 630-321-4371. Okay, perfect. And let's see. I'm going to ask you a few questions. I want to make sure that I have everything that I need before we begin the cranial nerve exam. Okay? Okay. Do you have any asthma? Okay. What about bleeding disorders? No? Good. Blood pressure? No. COPD? Diabetes? Okay. Ear and sinus infections? No. Good. What about fainting disorders? No. What about GI problems? No. Okay. What about heart disease? No. Good. What about kidney disease? No. Okay. Good. Learning disorders? Not that you know of. Any musculoskeletal problems? You don't know. Okay. What about psychological or psychiatric problems? Not really. Okay. Any seizures? No, that's good to know. Sickle cell disease. Don't worry, if you don't know what it is, it means you don't have it. Any sleep disorders? Yeah, I know. This is the most common one. Definitely. So, are you doing anything for your sleep disorder? Okay. Good. Good. Okay. Good. Have you ever had a stroke? No. Good. Any surgeries in the last 12 months? Not really. Do you have thyroid disease? No. Have you ever had any serious injuries? Okay. No. Good. And can you please list all the medications that you're taking right now? Okay. What about dosage? Okay. And how often are you taking that medication? Good. And do you have any allergies? Okay. That's perfect. Perfect, perfect, perfect. So, I'm gonna go ahead and do a very quick cranial nerve exam, okay? Great. Okay, so I'm gonna need you to look right here at my fingers. Very good. Just look at my fingers. Okay. And just follow my fingers with your eyes only. Don't move your head at all. Good. Good. Okay. Very good. You're doing great so far. Okay. Just keep on following my fingers. Okay. Now, please tell me when you don't see my fingers in your field of vision. Perfect. Perfect. Good. Good. Okay, awesome. Now, I'm going to do the same thing, so I'm going to ask you to follow my fingers. Good. 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 Okay, very good. Just keep on following my fingers. Okay. Good. Perfect. Okay. So your eyes seem to be working fine. We're gonna go ahead and check everything with the light. So just look straight at my nose. Okay, good. Look straight at my nose. Okay, good. Look again at my nose. Good. And look again at my nose. Okay, perfect. Now I'm gonna ask you to look at my fingers. Good. And now look at the light. Good. Now look at my fingers over here. Good. Now look at the light. Perfect. Now look at my fingers over here. Good. Now look at the light. Good. Now look at my fingers over here. Now look at the light. Good. Now look at my finger over here. Good. Now look at the light. Okay. Let's go ahead and change eyes. So I'm gonna have you look right here. Good. And now look at the light. Good. Now look right here. Good. Now look at the light. Perfect. Now look right here. Good. Now look at the light. Good. Look right here. Now look at the light. Okay, so everything seems to be normal. Now I'm gonna have you look right here. Look at my whole hand. And now follow the light. Good. Good, 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 good. Just follow the light. Good. Now tell me what shape I'm drawing. Good. What shape am I drawing now? Good. Perfect. Okay. What shape am I drawing now? Okay, great. Now please tell me when you don't see the light in your field of vision anymore. Good. 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 And with the other eye. Good. 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 Okay, great. Now go ahead and follow the light. Okay, very good. Very good. Just keep on following the light. Good. Good. Excellent. Let's go ahead and try some drops. So I'm gonna have you just open one eye just like this. Okay, good. And I'm gonna do one drop. Good. Excellent. And now I'm gonna try that in your other eye. Okay? And we're gonna draw one more drop. Okay, so that was perfect. Do you feel that a little bit better? Okay. Can you please tell me how many fingers am I holding? One, good. How many fingers am I holding? Two, good. How many fingers am I holding? Good. One. How about now? Four, good. How about now? Good. How about now? Good. How about now? Good. What 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 about now? Good. a little bit forward, okay? And I'm gonna have you look right over here, okay? And I'm going to bring this just a little bit closer, and I'm going to put it right inside your ear canal, and I'm gonna look right inside there. Good. So we have a lot of earwax. I'm gonna have to clean that up. Make sure that everything is clean, that we don't have any excess earwax, and no signs of infection. That sounds good, right? Good. And now we're going to check your other ear. So I'm gonna need you to look right here. Good. And I'm gonna do the same thing on the other side. So please look the other way. Good. And I'm gonna look that way. Good. And I am able to see a little bit of earwax as well. So we're gonna have to clean that up. Clean that up. Clean that up. Very good. Okay. So that seems to cause some problems for sure. And I'm gonna take a look inside your nose. I'm gonna have you look up for me. Good, 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 good. Just look up. And I see no deviated septum. The mucosa looks pink and moist. No abnormalities noted, no masses. So that's very good. You know, the mucosa is not very dry, so that's good. That's good. Everything looks very healthy. I'm gonna take a look inside your mouth as well, if that's okay. Okay, so I'm gonna need you to open your mouth as wide as you can. Good. And just stick your tongue out and say ah. Good. Ah. Okay, I'm not noticing any abnormalities there. Everything looks pink and moist, and the mucosa is normal. Also, your lymphatic nodes are very normal as well. Nothing is swollen. So that's very reassuring. Okay. And can you please stick your tongue out for me? Okay. Up and down. Good. And now side to side. Like that. Okay, great. And can you please smile? Good. And now frown. Good. And puff your cheeks. Good. I'm just going to buck them. Okay, good. One more time. Just puff your cheeks. Okay, good. So that seems normal. And if you don't mind, I'm just going to touch your sinuses, okay? Does that hurt? No. Does that hurt? No. Okay. I have a few more sinuses right here, right underneath your eyes. No, that doesn't hurt. That's good. No, that doesn't hurt. That's good. Okay, that's good too. That's good. Okay. I'm gonna do an ocular pressure test. And I'm gonna have you look right over here. Okay. I'm gonna bring this as close as possible to your eyes. Okay, and I'm just going to check your ocular nerve. So I really want to know if your eyes are doing that well. Can you please hold your breath and pinch your nose? Good. Okay. That's perfect. That's perfect. I couldn't have done better. Everything looks normal. And now we're gonna go ahead and check your other eye. So please pinch your nose and hold your breath. Okay, very good. Excellent. Good. Everything looks good and normal. Okay. I wouldn't be concerned if I were you. And I'm sure you would like me to test your strength as well. So I'm going to tap on your face a little bit. Make sure that you have proper reaction. So just focus right here. Okay, just focus this way. Okay, and I'm going to very gently and lightly tap on your face. Did you feel that? You did, okay. And you felt that as well. Okay. Okay, good. And did you feel that equally on both sides? You did. Good. What about this one? Good. What about this one? Good. Now we're going to tap on your chin. Good. And tap on your forehead. Okay, very good. Now we're gonna need to check your color vision. So we need to mix a little bit the colors. Okay, done. I'm gonna ask you, what color do you see right here? Right here. Okay, good. What color do you see right here? Excellent. What color do you see over here? Perfect. And what color do you see over here? Okay, very good. Okay, let's go ahead and check your hearing. I'm gonna need you to close your eyes and please tell me with which ear you hear this noise, okay? Very good. Very good. Excellent. Excellent. Very good. Okay. Now we're going to create a vibration sound, so please tell me when you don't hear the sound anymore. Good. And now we're going to do the same thing on the other side. Good. Good. And it's over. Good. Okay. Now I'm gonna have you read these letters right here, the ones that are on the last level. So just if you can please tell me what letter you see. Good. Okay. What about this one right here? Okay, perfect. What about this one right here? Perfect. Good. And what about this one right here? Very good. Now I'm gonna have you just focus on my nose and please follow the pink color. Okay, good. Follow the pink color. Good. Now follow the orange color. Good. Follow the pink color. Good. Follow the orange color. Good. Follow the pink color. Good. Follow the orange color. Good. Follow the pink color. Good. Follow the orange color. Good. Okay. Now we're gonna go ahead and check your facial sensations. So I'm just going to very gently brush your face, and it's going to feel something, very gently. So I'm just going to brush, brush, brush. Do you feel that equally on both sides? No, because I didn't brush your other side. Very good. Do you feel that? Excellent. What about your chin? Do you feel that? Good. And what about your forehead? Okay, good. I'm gonna just take a look very close to your eyes. Okay. Okay, can you please tell me how many fingers I'm holding? 2, good. How many fingers am I holding? 3, good. Okay, how many fingers am I holding now? 1, perfect. Let's go ahead and change. Okay, how many fingers am I holding? 1, perfect. How many fingers am I holding? 3, good. How many fingers am I holding? 1. How many fingers am I holding? 5. Okay, so everything seems normal. I'm gonna go ahead and listen to your heart. So please just focus right here and breathe as normal as you can. And I'm just going to put this right here on your chest. And breathe normal, breathe in and breathe out. Good. And now I'm going to listen to your lungs, and really I'm just, trying to listen to see if you have any signs of pneumonia or something like that. And I really do need you to relax as best as you can and breathe in. Okay, and breathe out. Good. And breathe in and breathe out. Good. I'm gonna bring this a little bit closer. So just breathe in and breathe out. Good. And breathe in. Good. And breathe out. Good. And breathe in and breathe out. Good. Now I'm going to listen to your back. So just lean forward for me. And I'm going to ask you to breathe in and breathe out. Good. And one more time on the other side. Breathe in and breathe out. Good. Everything seems to be normal. I'm going to ask you to relax, and I'm going to check your pulse right here on your neck. Okay, good. And now I'm going to compare both pulses on the other sides. Good. Perfect. And if it's okay with you, I'm going to check your pulses on your wrists. Okay. Very good. And on the other wrist. Very good. Okay. Now we're going to go ahead and check your eyes with a different kind of light. I'm sure you're very used to this light, so I'm just going to ask you to look right here. Okay, good. And now to look at the light. And just let me swing it right here in front of you. Good. And just keep on looking at my light. Don't look at my fingers. Good. And now I'm going to ask you to look right here at my fingers. Good. And now look at my light. Good. Let's go ahead and do a very quick exercise. I'm going to ask you to identify which fingers are moving, right or left. Good. 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 So everything seems to be normal. I'm just going to ask you a few more questions, and then I think we're going to wrap up please just look right here and tell me, how many fingers do you see? 1, 2, 3, 4, 5. Okay. 1, 2, 3, 4, 5. Very good. And how many fingers do you see? 1, 2, 3, 4, 5. Okay, very good. 1, 2, 3, 4, 5. Very good. 1, 2, and 1, and 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 2. Just look at my fingers. Okay, good. Okay. Now look right here. Okay. Now look right here. Good. 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 Now look at both fingers in the same time. No worries. I know it's very hard. Just do it. Good. Good. And good. Now tell me when you don't see my fingers in your field of vision. Good. 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 Okay. So let's go ahead and wrap it up, and I think I'm gonna write down everything that we've done today. But your cranial nerve exam seems to be a little bit wacky, a little bit on the abnormal side, so we're definitely gonna have to do more of these. Does that sound okay? Great. It was a pleasure to meet you, and thank you so much for coming in to, do these cranial nerve exams.